Hello, hi, namaste. Welcome to Adya Media. This is your anchor VC. So right now I'm from a Kim's. So I have visited a Kim Sunshine Hospital, and from there the most consultant neurophysician Dr. Vinod Kumar sir is with us. So let's know what is headache is, how the people will get a headache, and what are the precautions we need to take care. So these all have some of the queries. So we'll discuss with Dr. Vinod Kumar sir. Hello, sir. Namaste.
Yeah, hello. Yes.
So why a general people will get a headache, sir?
So headache is a very common condition. Okay. So commonest type is tension type headache. So many people, around nearly 70 to 80% of the people can get headache. That is tension type headache. So tension means due to recent days everybody has a lot of stress. Okay, that stress induces headache, either anxiety, either depression, either stress. So anything can cause headache. So generally that headache starts in the around the eye and then it goes back and then causing neck pain. So sometimes they may get little nausea feeling also. So if the headache is there, that is tension type headache. So they have to reduce the stress and then take painkillers in that particular situation. Okay, that tension headache can go down. And then another commonest type is migraine. So migraine is a very common. So nearly 20 to 30% of the people affecting now. So major female young females. Okay, so 15 to 25 years in between they get frequently. So one of the commonest reason is genetic. So family, the parents has headache, they transmits to the kids like that.
So, sir, this headache is very similar to migraine, sir, or like a headache is also equal to migraine, sir?
Yes, migraine is a type of headache.
Okay.
Okay, so that is a cluster conditions in the headache.
Okay, sir.
Okay, so in the tension type headache is commonest, and then migraine is the another commonest type.
So, if we get the headache severe, then only it will lead to migraine, sir.
Not like that. Migraine is a separate entity of headache. Okay,
Okay.
out of many headaches, migraine is very special, very particular character features, symptoms. Migraine treatment is also there, so that is common nowadays.
So, how can we differ, sir, this headache and a migraine? If a person gets, how can we can judge the person is getting a headache, and how can we judge the person is getting a migraine?
Yes, yes. There are certain symptoms are so common in migraine. So that is unilateral headache. It starts only in the one side of the head, and then that vessel is pulsating quality, and then it is moderate to severe intensity. Some patients may associated with vomitings, and then nausea, and then some are sensitive to light, and then sensitive to sound, and then sensitive to smell also. Okay, and then that lasted for 4 to 72 hours in between. Okay,
Sir, I have
when the
seen many
patient,
people who are suffering with a migraine, they just bang their heads.
yes.
In what condition, at what extreme level will they go to bang their heads, sir?
Yes, yes, it is I told you already, it is moderate to severe headache. So sometimes cannot bear it actually. So these are all acute episodes. That episodes will be so severe and then unable to tolerate. Main thing is if you move more, that headache is also will increase. So that's why if the bang head, that headache will more. So that's why when the patient get headache in migraine patients, they have to keep quiet, go to the dark room and then switch off everything and then take rest. Okay, if you move more, if you bang head, that headache will more. Only few headache conditions they bang the head. In that is migraine is one of the headache.
So, how can we identify this, sir?
Only there are clinical symptoms. Okay, so 5 headache episodes lasted for 4 to 72 hours. 2 out of 4 conditions like unilateral headache, pulsating quality, then moderate to severe intensity. That headache will suppresses their daily routine activities. Okay, out of 2, if there is, that is criteria for headache, and also out of 1, out of 1 in out of 2, like nausea or vomitings, and then sensitive to light or sensitive to sound. If it is there, so we can tell that these people are suffering with migraine.
Is there any surgery, sir, for the migraine to get reduce the migraine?
There is no surgery for migraine. Okay, migraine is a clinical condition. There is no cure for, there is, we cannot cure the migraine. Okay, migraine mainly it comes to the triggers. Okay, so there are a lot of triggers. It increases the migraine headache, like lack of sleep, and then junk food, fermented food, chocolates, coffee, and then if you skip the meals like that.
Morning breakfast.
Anytime if you skip the meals, that will trigger the migraine. Okay, and then lack of sleep, excessive stress, So these are all triggers of migraine.
So do chocolates cause to lead to headaches, sir?
Yes, some people get may trigger migraine due to chocolates. Not all, some.
So what if they found that they're getting chocolates, headache with the chocolates? So in that condition, what they do should do, sir?
They have to quit the chocolates. That's it.
They have to sacrifice.
They have to sacrifice. Especially young girls, they like chocolates more.
Yeah, we
If
all love it.
generally that migraine patients themselves, they know that after taking chocolate that headache will more. So they
Okay.
themselves know, but sometimes they hide because of they like the chocolates. And then treatment. So there are treatment options are there for migraine. So acute medications. So it will abort the headache, like NSAIDs, painkillers, and then triptans, ergotamines. They immediately stop the headache. When the headache starts, some people know that they are going to get the headache with some symptoms. If it is there, if you take the tablets, that headache will abort. And then preventive medications. It prevents the headache recurrences. Okay, who they need who they need preventive medications. So 2 or more headaches in a month that disturbing their lifestyle, moderate to severe headache, then they have to take the preventive medications. There are certain group of medications are there for the calcium channel blockers, beta blockers, anti-epileptics. Some are drugs we can give to prevent the headache frequency, and also non-pharmacological like yoga, meditation. Okay, that also it will suppresses the headache frequency.
So at what is the correct time to approach your doctor, sir, to control this headache, migraine headache, or like a headache one, so that they can reduce
Okay.
it completely?
And any people, anytime they get the headache due to lack of sleep and then work pressure, family stress, studies. Say any people can get headache, but when they want to go, when they want to approach doctor, means that frequency of headache is more, and then that headache is disturbing their lifestyle and their routine activities. So then you have to meet the doctor. If it is not disturbing their work, it is not disturbing the routine activities, okay, that headache is only mild, so without taking tablet that headache has come down, so they need not to go to the hospital actually.
Thank you, sir. Thank you so much for the information, sir. So I really, I have got to know many things that at what time the client, like patient, should approach to the doctor, and what precautions they should take. Thank you, sir. Thank you so much.
Yeah, thank
So I hope viewers, you have clarified your doubts and what time you need to consult a doctor. At the same time, if you guys are having any diseases like your friends or anyone, do comment in the comment box. And if you like the video, like it, share it, and subscribe it. Thank you.